So first up, I want to speak about correcting scoliosis without surgery. And so it can sound like that is impossible. And I just want to share from my experience of when I had my practice. So I had a practice for over 10 years in Melbourne, Victoria, in Australia. And in my practice, I was working with people to help them heal from all different types of, back pains and diseases and illness and different types of things that were going on. And every single client that came in, I would have a feel to see what was going on in their spine. I'd palpate the spine to feel what's going on. I'd do the gateway assessments, I'd do postural assessments, and I'd be able to track and see what's happening in the curvature of the spine. I had heaps of clients that came in that had what we call a scoliosis, which is a sideways curvature of the spine. So if you have a look at here, we've got the thoracic spine there. A scoliosis, I'm going to exaggerate, is a sideways curve. You might have heard kyphosis is that forward bending. Scoliosis is a sideways bending. So again, I'm exaggerating. I'm definitely exaggerating. So when you have a feel of your client's spines, you can run your hand down the spine, and often if it's coming out to the side, it can be that there's a scoliosis present. What happened for me was the more I worked with the client, the more I started to notice that the scoliosis was getting less and less and less. There were areas in the scoliosis that were hard, and it felt like there were spinal blockages in there. And the more I worked with spinal flow, the more I started to feel that there was more ease and flow, less blockages, and to me it looked like the curves were changing. When this was happening over and over and over, I wanted to see more. I couldn't understand how this gentle modality that honored the body, that worked with the wisdom of the body, that was gentle and it was beautiful, how was that correcting scoliosis? So I bought an X-ray machine. And I'm not telling anyone to go buy an X-ray machine. I needed to do that. I justified the radiation of, my clients were coming to see me and I wanted to see what was going on in their body, and I wanted to see what their spine looked like before compared to after. At the time, we looked at the one X-ray of the spine being similar radiation to a flight between Melbourne and Sydney. And for me, I was like, well, you know what? When they're coming to see me, their life is changing, and I can justify that because I want to see it. But again, I'm not telling anyone to go buy an X-ray machine. So what I did was I took X-rays. My background as a chiropractor meant that we do have a license, so I can take my own X-rays, front, side. I was having a look at seeing what is happening with the scoliosis, with the curve. Before they started, they would come then and do some intensive spinal flow with me, and their curves changed. I took an X-ray after. I'd put both X-rays up, and I could see massive amount of change. And for me, that showed me that what I was feeling in their body, I was also seeing on X-ray. At the time, because these changes were amazing and incredible and people were talking about it, I got referred to work very closely with quite a few orthopedic surgeons that had people that came in, or young girls that were looking at having braces for their scoliosis. And they would say to me, Carli, all right, I'm not going to do the brace or the surgery. I'm going to give you 3 months to work with this client, see what happens. And they would take the X-rays. The X-rays got referred out then to the medical imaging place before, and then 3 months later we took the X-rays and we saw such incredible change. And for me, it was incredible to work so closely with these orthopedic surgeons and really helping these girls start to change their spine. And we really got to work. We looked at everything. We looked at what the cause was. A lot of the clients that I saw, the cause, they weren't born with this big scoliosis. It was acquired, it came after. Some of the big causes of scoliosis, it might be, like breasts. As a teenage girl starts to develop breasts, doesn't matter if they're big breasts or not, they start to compensate. And by hiding the spine, that can start to cause a scoliosis. So a lot of backpacks or bags that were held on one side while the spine was growing. Some men that came in, like if they were a little bit taller than their friends, they would actually start to bend down to compensate. It might be like a one-arm sport or one-arm something that's creating imbalance in the body. So when I work with my clients, I always want to find out what the cause is. If we can find the cause, because it doesn't work to help someone and completely change their curves and create softness in their spine, but still for them to have that stress that's causing the scoliosis. So it's really important to look at what the cause is. Where does it come from? So when we identify that, we can really help clients. The other thing is, if the reason a client has scoliosis is still present and we're working really hard with spinal flow to decrease blockages and increase the wave while that stress is still going on, that's really, really hard. So we really want to make sure that they're removing that stress from their lives. And that's where I spoke to a lot of my clients and just said, look, if you're, whatever it is, we need to really look at reducing or eliminating that stress so we can move towards greater healing. So when you're working with someone that has got scoliosis, the really fun thing, which I find fun, but I could be a little bit weird, is to track it. So as they're lying down, I used to track, where there was movement in the spine, where there wasn't movement in the spine, and where it moved again. And I would have a look at that. I'd also have a look to see where there was breath and where there was not. I'd have a look to see where there was hardness, spinal blockages, if there was spinal blockages there as well. And then when I started to work with a healing session and bring in more wave and release blockages, I would track again to see the changes that happen. And I was constantly monitoring what was going on. And I would get really excited because often with scoliosis, what happens is if there's a sideways bend through here, just say it's all through the thoracic spine, underneath the scoliosis can be compensating so much. So the areas underneath can be quite hard. The areas on the top can be quite hard because if this scoliosis is curved, it's not weight bearing like it needs to be. So it starts to weight bear underneath. So we're really looking at the whole spine. Everything we do anyway is working with the wisdom of the body and looking at the body mind as one unit. It's connected. And so it might be after one session that rather than having just hardness and stuckness through here, there's a lot less. And then there's a lot less. And as you work with your clients, there'll be a lot less blockages and more flow. And you get to feel that and track them and to show your clients, like, hey, when you came in, there was a blockage from here to here. Now it's here. Now it's there. And as you start to feel under your hands that there's more softness, there's less blockages, there's more wave coming through, you can really, really help your clients with scoliosis. So for me, that's something that I really, really, really loved working with. And I really loved, helping people with curvature. And it's not even just about the curvature or not, because it's, there are some people that are looking at, needing surgery and needing operations. It's really about having that movement. Now remember, with the spine must be flexible and the spine must be soft. We want the spine and the vertebra to have good movement like that. That's how we're designed to have this soft, free-flowing spine. When there's hardness in your spine, for example, in your thoracic spine as a scoliosis, there can be hardness in your life. When your spine is blocked and stuck and rigid and the muscles are contracted, often life is stuck and contracted and rigid, and there can be pain and disease and illness. So we are no different to our spine. One of my teachers said, the shape, tone and position of your spine reflects the shape, tone, position of your life. As Donald Epstein said that. And it's really incredible. When he said that, I'm like, yes. When I have a feel of someone's spine, I know exactly what's going on in their life. I know exactly how they're feeling. I know exactly how much energy they have. And for us, and we know someone's got a scoliosis and there's tightness, this is the chest, the center gateway. It's where the heart is. If that's stuck and contracted and it's compensated, often their heart, their feelings would be closed down as well. So we can really, really help our clients with scoliosis. And how we do that is, with the spinal flow technique, working on the access points to bring in more wave in the body, more ease, less blockages, less disease, less illness, and growing that softness so every single vertebra of spine starts to move. And you will track it and you will see, you'll be able to watch and feel what happens when your client first comes in to after each session when it becomes straighter and straighter. And that's what I did. That's all I did. I was watching it person after person after person, and I was like, I'm sure their spines are changing. And I have no idea, and until I bought that machine, and I x-rayed. I used my x-ray machine for years and years and years. And what happened for me, the before and after x-rays of, I'm gonna chuck out 95% of my clients were incredible. And it showed me how much healing is possible in the spine. And so, working with your clients with scoliosis to really, really help change the curves. I know for myself, that's something that I did for many, many, many years and got incredible results. And it's not about my results, it's about changing people's lives so they can have more flexibility in their spine, more openness, and feel different in their whole body. So super exciting. And for you guys just to check and to have a look at, do before and after. Always good to get the posture apps and actually take a photo before, take a photo after, so you can actually show your clients progress, because it's going to really help them see what change they can have and how Spinal Flow can really help them.